So I'm checking the patient's chart and I'm recording the start time. It's 1:30. Okay. I'm Mr. Jonathan. My name is Jeff. I'm your respiratory therapist for the day. How are you doing today, sir?
All right.
That's good. Can you please verify your full name and date of birth for me, please?
Jonathan Blackfoot, May 2nd, 1992.
Alright, perfect. Do you have a medical ban on you?
Yeah.
Just a sec. Alright, perfect. Alright, Mr. Blackfoot, so I was reviewing your chart. It looks like you're getting discharged today. Are you excited?
Yes.
Yeah? Okay, so I have 2 medications that the doctor prescribed for you, which I'm going to be going over shortly. But before we begin, I'm going to take your vitals first, okay? So I just need to borrow your finger. I'm going to check your oxygen levels with this pulse oximeter. I'm going to clean up the probe. Alright. Alright, and that's a pulse ox. Alright, so while that's going, I'm going to go ahead and check your heart rate and respiratory rate, okay? Alright, perfect. I'm going to go ahead and listen to your breath sounds now, Mr. Jonathan. So when I put my stethoscope on your chest, I just want you to take a nice deep breath in and out, okay? We're going to check 6 breath sounds on your front, 6 breath sounds on your back, okay? Alright, go ahead. Okay, again. Okay, perfect. If you could just lean forward for me, please. Alright, nice deep breath. Okay. Go ahead. And one more. Alright, Mr. John Thulu, your breath sound clear. Your respiratory rate and heart rate are normal. Have you been able to cough lately?
Yep.
Yeah? Okay. And when you cough, what do your secretions look like? What color are they?
It's clear.
Clear? That's a good sign. Oh. Yeah.
Yeah, just that.
Mm-hmm. This is alright, perfect. Alright, Mr. John Thulu, so I'm going to go over the 2 medications that the doctor prescribed. The first one is albuterol, and it's going to be in a metered dose inhaler form, or MDI. So this contains albuterol. Albuterol is a beta-2 agonist. This is going to help open up your lungs and allow you to breathe easier and a lot more comfortably, okay? So when you use this, there is a chance that you could experience some increased heart rate or tremors, but these are all normal side effects, so they will subside over time, okay? When you use this, you're gonna want to remove the cover for the albuterol, for the MDI, and remove the cover from the spacer. Now, spacer is recommended to be used with the metered dose inhaler because it's going to allow you to receive more of the medication, okay? So it's very important that you use the spacer with your MDI, okay? So before you use this, it's very important that you shake it vigorously. You want to make sure that the medication mixes well with the propellant. Otherwise, if you don't shake it, you're going to inhale more propellant than medication. That's not what we want, okay? So you want to make sure to shake it like this, and then if this is your first time using this meter dose inhaler, or if you haven't used it for 2 days or more, you want to prime it. And by priming it, all you have to do is shake it, and then you want to spray away from yourself, away from anybody. Just want to spray twice, okay? Just like that, okay? And then that's primed. So what you want to do, once the cover's off, you want to inspect the insides of both your spacer and your MDI. Just make sure there's no foreign objects in there. And once they're inspected, you want to connect the two together. Just insert the mouthpiece into the spacer like this. You're going to want to make sure you're sitting up straight or standing up straight. Have your head tilt back just a little bit like this. You're going to exhale like that. Then you want to hold the device upright like this and make a nice seal with your mouth on the mouthpiece. And then as you inhale, you're going to actuate the medication. And then you're going to inhale all that medication. And then once you inhaled completely, you want to hold your breath for about like 5 to 10 seconds or whatever's comfortable to you, okay? And then you're going to exhale away from the device, okay? All right, Mr. Jantilu, you have any questions how that's done?
No.
Okay, so the doctor did prescribe for you to take 1 puff right now. So if you can, you think you can perform that for me?
Yeah.
Yeah? Okay. Give it a shot. All right, yeah, that was perfect. Good job, good job. All right, so the next medication, by the way, that medication is gonna be your rescue inhaler, right? So that's gonna be like a rescue drug for you. So whenever you're feeling any sudden shortness of breath, you wanna take that 2 puffs of that MDI, okay? But make sure before you take a second puff, you wanna wait 1 minute in between, okay? That's very important. All right, now moving on to the second medication. So this is Advair in the form of a DPI or dry powdered inhaler. So this consists of 2 medications in this one device. Okay, there's salmeterol and fluticasone. Salmeterol acts the same as the albuterol treatment, so it basically opens up your airways and allows you to take more comfortable breaths. But the difference is this actually takes longer. It lasts longer, but it takes longer for it to work, okay? So you don't want to use this drug for when you're having like sudden shortness of breath. You want to use the albuterol, okay? This also contains fluticasone, which is a corticosteroid. So what that's going to do is going to help reduce any inflammation in your lungs, okay? Fluticasone, Advair in general, it has a tendency to cause like hoarseness in the throat and oral thrush, and also cause you to cough. So it's very important that after each use you rinse your mouth with water, okay? Okay, so let me demonstrate how this is done. So if you notice in this device there's going to be a meter here. This number here is going to indicate how many doses left inside the device, okay? You're going to open it, you're going to pull the thumb grip all the way around, just like that. And you're gonna notice that there's a lever here. You're gonna pull back the lever until you hear a click. And what that tells you is that the capsule is punctured, so it's gonna allow the powder to be released. So it's ready for you to use, okay? Make sure when you're ready to use this, you have it held horizontally like this. You don't want to tilt it forward or back because the medication can fall out, okay? So when you're doing this, you're going to exhale fully, like that. Make sure it's held horizontally. Make sure you're standing up straight or sitting up straight. You're gonna make a nice seal around the mouthpiece with your lips. Then you're gonna inhale forcefully and deeply. So you're gonna go, and then you want to hold your breath, so allow the medication to get deep in your lungs, okay? And then about 5 to 10 seconds of holding your breath, you're going to exhale away from the device. You don't want to inhale. You don't want to exhale into the device because the humidity of your breath could cause clumping in the inside because there's powder. Okay. All right. You have any questions? Do you think you can perform that for me?
Yeah.
All right. So the doctor did order one actuation right now. So whenever you're ready, go ahead and take an actuation from that DPI.
Is that all right?
Yeah, perfect. All right, so looks like you're good to go. It looks like you know how to do it pretty good. So, do you have any questions for me?
No.
No? You have any questions about the medications at all? No?
No.
All right. So before I go, I'm gonna go ahead and take some post vitals. Okay? Make sure everything's all good. So I'm just gonna disinfect the pulse ox again. We're just gonna do the same thing as we did earlier. Check your oxygenation. Check your respiratory rate, heart rate, and your breath sounds, okay? All right, so I'm just gonna check this right now. Okay. All right. All right, so John Dulu, I'm just gonna listen to your breath sounds again, okay? All right, deep breath. Again. Again. All right, if you can sit up for me, please. Deep breath. Okay. Alright. Alright, your breath sounds are good. Oxygenation. Alright, perfect. So your heart rate just went up just a little bit, but like I said, that's normal for Buterol. Nothing crazy. Alright, Mr. Dulu. So we're all done with everything. So you have any questions for me or need anything? You comfortable?
No. Yeah.
All right. So if you have no questions for me, I'm all done here. And if you do have any questions in the future, just go ahead and feel free to let me know, let your nurse know, let your physician know, and we can go ahead and we'll be more than happy to assist you. Okay. All right, Mr. John Thiele, we'll have a good day. All right. So I'm just taking my gloves off now, gelling out, and recording my end time. All right, Mr. John Thulu. Okay, now I'm leaving. Okay, so the mode of action for albuterol is it attaches to beta-2 receptors, causing smooth muscle relaxation in the lungs. Mode of action for Advair is a maintenance drug. The salmeterol portion of it is a beta-2 agonist, which stimulates the beta-2 receptors and causes smooth muscle relaxation in the lungs. The fluticasone upregulates anti-inflammatory cells and downregulates inflammatory cells. And prominent side effects are oral thrush, tremors, increased heart rate, cough, and that's why it's important that you rinse your mouth after every use. And the best way to assure a patient can properly use a therapeutic delivery device is to have the patient return the demonstration. So basically redo the what you explained to them. Yeah, that's it.